when you are treating them, what are the characteristics on your subjective exam that would give you like a hint or a tip that would show you that the headache could come from the cervical?
Okay, so when you are talking about primary and secondary headaches, this is a classification from the medical model. Okay, headaches are within the medical model. Everyone in the whole world are using the medical model classification system. The International Headache Society is the big guy around the world, and they are the ones setting all the classifications, and they are the ones defining which is a migraine, which is a tension type headache, which is what's a cluster headache, okay, and what's primary and what's secondary. Primary doesn't mean that you don't know the cause. We don't know the cause for primary, but this is not the reason why they are called primary. Primary are called because the problem is the headache itself, okay? And secondary means that there is another thing causing the headache. For instance, if you have fever, okay, or you have cancer, you may have headaches because of this, okay? Or you can have a problem in your neck and having a headache related to the neck as a source of your problem. Then you have a secondary headache, okay? But primary means that the problem is the headache itself. It's not because of other things, okay? There is not an underlying cause for that, okay? And when I'm doing my subjective, well, it's very difficult. It's very difficult just from the subjective, from the things that the people are telling you, if you know, okay, this is going to be really cervicogenic or not. Why? Because migraine, tension type headache, and cervicogenic headache, they overlap symptoms, okay? So they overlap symptoms, they overlap locations, they overlap type of pain, okay? So it's very difficult to distinguish sometimes between one headache and another headache. So you don't really from the subjective are always certain to be dealing with a cervicogenic. If the patient is telling you that when he's doing some postures with the head or the neck, or doing some movements on some postures, and they say, when I do this, my headache comes or increases or it gets better, maybe you have a hint that maybe your neck is involved in this process. But other than that, it's really difficult just from the subjective to have a real cause of headache, cervicogenic headache.